Hello and welcome to this recorded webinar from the HCPC. This session is about scope of practice and it's part of a series of recorded webinars entitled My HCPC Standards, and they're designed to support our registrants in meeting the HCPC standards. This year we're focusing on the revised Standards of Conduct, Performance and Ethics, and I am Florence Milliken. I'm the HCPC Professional Liaison Consultant for Northern Ireland. I'm recording this in July 2024, ahead of the revised Standards of Conduct, Performance and Ethics coming into effect on the 1st of September. This is not an e-learning module, and there's no set criteria that you'll be required to learn. There won't be a certificate of attendance available for this recording, but just a quick reminder that at the HCPC, we don't make certificates mandatory when evidencing CPD. We would encourage you, though, to use another means of confirming your engagement and make sure that you do take time to reflect on it. I'll be presenting slides throughout the session, which you'll see on screen, and you can use the timestamps in the description below to navigate through the topics. So let's just get into the session. So we'll first look at what the revised standards say around scope of practice. During our consultations, we were often asked what we meant by scope of practice. So we've added clarity by saying it's about having the knowledge, skills and experience to meet the needs of the service user safely and effectively. And it's that addition of the words safely and effectively that make it clear that our primary interest relating to scope of practice is the safety and effectiveness of care. We do not have a list or a set of tasks that you can or cannot perform because we acknowledge that the many varied contexts in which you work. But in all of those contexts, it's public protection and safety that is the primary concern. And we know that your scope of practice will change over time, and we've been getting more queries in relation to guidance about taking on new roles, which is a great reflection of the changing nature of health and care in our 4 nations. And some of you have talked about being asked to take on new roles and tasks which were previously beyond your scope. So this second point clarifies that you must undertake additional training if you want to widen your scope of practice. And this correlates back with providing care in a safe and effective way. And another common query following on from that centred around what to do if you cannot provide care because it was outside of your scope. So our third point makes it clear that when you're referring a service user to somebody, it must be to somebody for whom it is within their scope. I spoke recently to some paramedics who were telling me in their new roles, they often have to make decisions about who to refer a patient on to, because not everybody automatically does go to hospital. So it's about referring patients on to the right professional or being able to recognise when you don't have the scope for a task and that you don't just simply give it a go and hope for the best. Now, the next point still relates to scope of practice in relation to your CPD, following the law and seeking feedback, but they have not been changed because people felt that they were clear and that they didn't require any additional changes. And then the same can be said for the specific standard on delegation, which is standard 4, and you'll see it relates quite closely to the previous one. So when it comes to determining what is and is not part of your scope of practice, that'll be for you to decide using your own professional judgment. You know you best and how you've changed since you first qualified. And I think even in recent years, we've all made changes to how we work, as this photo would allude to. I certainly remember as a physio over COVID times, learning and developing new skills, managing my patients over the phone and via video calls. That was something I'd never done before. So my scope was changing. And of course, that skill continues to be developed for many people now as we recognise this is a new way of working and it can be very helpful. However, there are new things that must be considered in relation to things like privacy, or maybe how you need to change your communication, your professional boundaries, and of course, recognising when a patient needs a face-to-face. And in order to develop this new scope then, we may have needed further training to ensuring that our care continues to be safe and effective. Now, the next few slides provide a visual help for describing individual scope and profession scope, and it's adapted from a paper by Dow et al. In 2023. So here we can see that individual scope of practice will generally fall somewhere within the profession's scope of practice. So the scope of your profession is nearly always broader than the scope of one individual within that profession. And that reflects the diversity of activities in our professions and the many different contexts that we work. And of course, just as our individual scope is dynamic, we have also seen a shift in the scope of our professions in recent years, with registrants being trained in areas not traditionally considered part of their profession. And the HCPC do not list what a profession can or cannot do because we don't want to restrict practice, and practices change. So what may in the past have fallen outside of the scope of your profession could now be considered within its scope. So for example, things like injecting and prescribing. However, you may be in a new role where you're asked to do something that falls outside of the scope of your profession. This means you need to consider, do you have the skills and the knowledge to carry out the activity safely and effectively? And if it is outside of your profession's scope, it's likely that you will have had additional training. But you also must consider and ensure that your professional indemnity insurance will cover this activity, as you know this is a requirement of your registration. So you'll therefore need to discuss this with your insurance provider. But either way, whether a task is within or without the scope of your profession, it's important to realise you must stay within your own individual scope of practice. This diagram relates to two individual practitioners who are probably colleagues, same profession and equivalent roles, but you can see slight differences in what they can safely do. And that just highlights that your scope of practice is likely to vary from your colleagues despite being in equivalent roles, because it is dependent on your professional experience and whatever additional education and training that you have had. So just because your colleague does a task doesn't necessarily mean that it is safe for you to do it also. And again, here we have two different practitioners in the same profession, but different roles and levels of experience. So as we progress in our careers, it is likely that our scope of practice can widen and change and will be very different from our colleagues. And I think this illustrates quite nicely how one practitioner can change over the years. So many of our professions, as a new graduate or even someone moving into a new role, you're likely to demonstrate a wide breadth and limited depth initially. And in time, through experience and the appropriate training, this progresses to a much tighter breadth but extreme depth. And at this point, it's likely that not all of the standards of proficiency which guided you so well in your early career will continue to be relevant for your role. And there's often this misconception that registrants must always be meeting all of the standards of proficiency. But in fact, what the guidance says is once on the register, you must continue to meet the standards of proficiency that apply to your scope of practice. So we know that some of the standards of proficiency will no longer apply, particularly when it comes to working in a narrower scope. Your CPD will therefore also change, and it will be relevant to your current or your future practice. And you are best placed to decide what is most beneficial to you. And I think what's useful to be reminded of here as well is that as our scope changes, we may lose the ability to do certain activities, particularly if our CPD focuses on the new role. And then these are the times where we may need to consider delegating a duty to another colleague or profession. And an example of this significant change in role may be someone working as an advanced practitioner. And many of you will know that our NMC colleagues have decided to introduce standards for advanced practitioner roles. And we do get a lot of questions about this in our policy inbox. And we've been working with our colleagues in the NMC on this. And whilst we support the development of principles for advanced practice, we have no plans to introduce additional regulation for these roles. And you'll find further information about that on our website. And in one final diagram, which this time illustrates the fact that most professions will share some overlaps with others, but there may be tasks that can safely and effectively be delivered by more than one profession. So for example, the prescription of a particular medication or a particular piece of equipment. And this is important to state because it is often in the best interest of the patient and a much more efficient delivery of healthcare when it does happen. So I just want to finish with a couple of scenarios. And the first one, well, it could relate to a new graduate or someone starting out in a new role. And they've been given a patient to assess, but they don't feel confident doing so. So the question really is, if I don't feel confident, does this mean I'm working outside of my scope of practice? And what should I do? So it maybe raises the question, well, what's the difference between confidence and competence? I certainly remember as a newly qualified physiotherapist being given a patient and not feeling confident to treat them, and that was simply because I didn't have much experience. But I did have training, I did have the knowledge and the skills, and my supervisor was confident I could treat the patient safely and effectively. Therefore, I was working within my scope. However, it is still a decision for you to make, and we trust our registrants to use their professional judgment to do so, and of course, expect them not to overestimate themselves either. And a common situation in recent years was being redeployed to an area that you hadn't worked for maybe in several years. So what do you do there? Well, each scenario needs assessed on its own merit. There could be new machines and new ways of working, or there may be very minimal changes. So it's up to you to discuss with your line manager and ensure you acquire any updates or training that's necessary to be competent. And it might also require you to raise concerns if that is necessary. And this also raises an important point, I think, for the one delegating, because equally you have responsibility to ensure you're not asking someone to do something which is outside their scope. Remember, our new standard says that you must only delegate work to someone who has the knowledge, skills and experience to do it. Now, you might relate better to the second scenario, where you're moving into a role that is more leadership based than clinical. And there are many opportunities opening up to registrants now, which is great. And many of these more generic roles could involve very new tasks like supervising staff from a different profession or background to yourself. Your staff may be requiring support in areas that you simply don't have the knowledge and skills in. For example, medicines management. So your role here will be to ensure that they know who to speak to and get that support. And then you focus on the areas that you do have the experience for. Maybe that's dealing with difficult clients or managing a complaint. So we all have different experiences. So we need to consider each situation in its own merit and decide whether it is within my scope. Or maybe it's not yet within my scope because I'm still receiving training on it. Or maybe I need to delegate this to somebody else for whom it is within their scope. And as I said, the other thing you need to check is whether you have the appropriate professional indemnity insurance to cover you in your new role. So a registrant can practice in a role which is not their protected title and remain registered with us, even if this new role has a narrower scope of practice. But you do need to check with your insurance provider if they cover the tasks that you're doing. And we would expect you to work within the limits and the expectations of that role and not practice in areas which go beyond it. Now, this might require you to limit the activities you perform or the skills that you exercise to what's on the job description. That's even if you would be qualified to undertake them if you were practicing in your protected title. So this is something that we do get asked about, but we wouldn't criticise a register practicing within a narrower scope if they're working safely and effectively within the limits of their job description. And I think you might find it helpful just to check your job description or maybe clarify this with your employer. And then finally, our standards say registrants must keep up to date with and follow the law, our guidance and other requirements relevant to your practice. So we expect decisions around scope of practice to be informed by the law. If there are legal restrictions on the roles or the tasks that you can perform in your profession, well, then you need to limit yourself to what is legally permissible. So for example, when it comes to prescribing. So hopefully that has helped. And if we just summarise then what we've clarified, we've talked about what we mean by scope of practice. The HCPC doesn't define your scope of practice, you will, and that's through your knowledge of whether your training adequately equips you to perform the activities safely and effectively. And your scope of practice may also depend on the limits of your job role, legal restrictions, and whether you're covered to undertake it by your professional indemnity insurance. But you may find it helpful to speak to your employer or your professional body if your query relates specifically to your profession. Otherwise, do check out our web pages. And if it's a little more complex and you do need to speak to somebody here, please do get in touch with our policy team. Now, I'm just going to use this opportunity to suggest you consider what support mechanism could be out there as you do consider your own scope of practice and how to develop that. So we've already mentioned the support from your line manager if you have one and from your professional body, but something you mightn't have considered is support from a community of practice. So for those of you who aren't familiar with the term, a community of practice is a group of people who share a concern or a passion for something they do, and they learn how to do it better as they interact regularly, and it may be online or face to face. So by way of example, a new community of practice has been developed for paramedics who are working in primary care because there was a recognition of the significant change in role going from an ambulance crew where there's lots of support around you to working sometimes as the sole practitioner in a team. And there were obvious questions arising, and scope of practice is one of those topics that needed to be addressed. So a community of practice was developed to support this, and that's a QR code there for any paramedic who is on our webinar who would like to join this group. But there are many groups around, although they mightn't be called a community of practice. And research does show that they can be a fantastic source of knowledge sharing and knowledge creation amongst similarly passionate colleagues, sometimes even from around the world as well. So that's just a little plug for communities of practice. So that's it for our session. Don't forget, in this series, we do cover other subjects relating to the revised standards of conduct, performance and ethics, and we'll have links to those in the description below. If you want more information on the revised standards, please do check out our website where you can view the revisions, explanations, and a few other things as well. And you'll also see future events that you can attend live. But here at the Professional Liaison Service, we do more than just webinars online. We can also arrange to come face to face to your place of work in all 4 nations. And we cover a range of topics which you can check out using the QR code here. So please do get in touch using our professional liaison email address here, and then we can discuss what we can do for you. And if you have any questions about the standards, please do feel free to contact our colleagues, as we said, in the policy team. Or if your query relates to a different topic altogether, please use the relevant addresses as we've shown here. So thank you for listening, and hopefully we'll see you back here for another session very soon. Take care and have a good rest of your day.